Good afternoon. My name is Alicia Lovesey, and today I will be discussing Goodwill Health Clinic and the concerns presented in my chosen case study. This clinic was first founded in the 1950s, but has since expanded to be the clinical arm of Jefferson Health Sciences Center. Currently, the facility has 2,000 employees, 900 physicians, and sees over 1 million patients each year, according to Wagner, 2009. Over the next several minutes, I will be discussing some of the challenges faced by Goodwill and how to best analyze implementation of an electronic health record messaging system. Goodwill Health Clinic's primary issue is their branch of the medical center has not fully transitioned to the use of the electronic health records messaging system located in their electronic health records database. Currently, the call center is using a system called Lotus Notes to communicate with the Goodwill Health Clinic branches. Not only is Lotus Notes duplicating work for the departments who use it, but it is costing extra money to maintain another system. This duplication leaves room for error with missing documentation or misfiled records. At this point, there is a function where clinics can directly message patients in the EHR messaging system that is not fully being utilized. This function allows for providers and patients to speak with each other, and the message is immediately filed in the correct record. There's less of a concern that a printed out message is filed in the wrong patient's chart. The initial and apparent issue with Goodwill Health Clinic not using the full capabilities of its electronic health record system is the need for centralized patient information. If Lotus Notes are filed in paper charts in one of the 11 section clinics, then providers in the other 10 clinics may be missing pertinent patient information. Continuity of care is a critical aspect of care, and it is made much more difficult by the barriers of multiple ways to chart patient records. Aside from those obvious quality care issues, Jokes 2019 cite that there are also second and third order effects, such as inaccurate patient data, medical coding errors, and medical billing errors. Collecting and reflecting upon medical information can be used to visualize trends and assess consistent issues. However, if patient information is not accurately captured, one can assume that data is off. Another aspect that should be reviewed are results of HIPAA breaches. Shaw 2021 discusses the importance of HIPAA to help protect patients and their health information. Using Lotus Notes, Goodwill is increasing the likelihood of breaches with medical records. With electronic health records, there is an additional layer of security with accessibility, or lack thereof. While paper charts may be stored in a secure location, there is still access by many people. It is much more challenging to track who is accessing a paper chart than it is for an electronic record. According to O'Donnell and Gupta 2022, continuous quality improvement methods are key to implementing a process. In this instance, it seems an effective method would be the DIMAC, which is a Six Sigma methodology of continued improvement. The aspects of this program are define, measure, analyze, improve, and control. Key players in implementation would be the hospital leadership team, clinical managers, and branches of the clinic who have already successfully implemented this messaging system. A recommendation to the clinics would be to start using all aspects of the electronic health record system. From there, management teams can account for further issues with the newly implemented process. There is a hope, once utilized, the clinics will see improved functionality and reduced redundancies. In the instance of Goodwill technology, it is crucial for an environment centered around quality patient care. Some of the clinics have been resistant to change, but others have already implemented the system. Managers are ultimately responsible for change management and shaping the culture around the vision of improved patient care and reduced workloads. As previously mentioned, there are third-order effects of data breaches with medical records. Eliminating a redundant system plays a key role in maintaining compliance to patient safety regulations and HIPAA guidelines, while also increasing continuity of care and medical record documentation, which ultimately creates data that feeds strategic planning. DIMAC, which is a Six Sigma methodology, is part of best practices. This allows for continued assessment of the system while monitoring efficacy of data integrity and glitches that may lead to further breaches or HIPAA violations. Goodwill needs to focus on the idea of interoperability, and if Jefferson Sciences Medical Center has made the switch to the EHR messaging system, it behooves them and their patients to do the same. The thought behind this is the avoidance of long-term issues with quality of care. In terms of economic impact, all of this seems to greatly behoove Goodwill Clinic and Jefferson Sciences Medical Center. If they consolidate to a singular messaging system, there will be almost instantaneous financial savings with getting rid of Lotus Notes messaging system. If you want to talk about long-term savings, there are many opportunities to see long-term savings. Some of the initial things that come to mind are going to be the likelihood of more accurate billing and coding, less time spent going back and forth with insurance companies about billing and coding, and also, like I've mentioned several times over, improved patient and quality care, which reduces the likelihood of long-term lawsuits. Thank you for the time today. This has been my final presentation over the Goodwill Health Clinic study.